Good morning, everyone. My name is Wachiraporn Peethong. I'm studying in the College of Dental Medicine in Rangsit University. Today, I'm proudly present you a clinical research study, the effect of Phayayor oral paste on gingival healing of extraction wound, a pilot study. Today, our contents will consist of 3 parts. The first part is part 1, research background. Due to our research study that talk about the simple wound extraction, so we'll go back to the basic. Simple extraction, in general, is defined as a technique for extraction of teeth, which is accomplished in two stages using an elevator and then forceps without opening gingival flaps. Okay, now let's go to the physiology of normal wound healing. It actually consists of 4 phases: the hemorrhage, the inflammatory phase, the proliferation, and the remodeling phase, which we will focus at the epithelialization and the proliferation phase. Now I will introduce you to our main character, Phayayor. Phayayor, or Clinacanthus nutans, is actually have the other name known as the snake grass. It's a perennial herb which can grow up to 1 meter tall. You can see that the leaves are simple and with a narrow elliptic oblong. It has been used for over years in Malaysia, Indonesia, China, and of course in Thailand. And it's also has been included in the Thai national list of the essential medicine in different preparations, such as cream for treated herpes and varicella zoster treatments, or solution that's used in intraoral treat for atlas ulcers. It's also have preparation of lotion for treating skin rash and urticaria, and of course the paste for treating the inflammation and insect bites. We are interested in Phayayor. There are flavonoids and propylene 18 phytoester. So what these 2 components do? Actually, they have 3 main actions. First one is anti-inflammation. Second is to promote cell migration. And the third one is cell proliferation. According to the study of Thanasorn in 1986, the study has found that the flavonoid compounds show anti-inflammatory action involved in the inhibition of prostaglandin synthesis. And there are also studies of Muhammad Shahzad Aslam in 2016 that have found that flavonoid increase the antioxidant activity, while the propylene 18 phytoester exhibits anti-inflammation. There are also other studies about Phayayor, and one of them is the study of Zijan in 2015, which has studied about the evaluation of the proliferative and cell migration effect of Clinacanthus nutans powder on the human gingival fiber cell line. The study has found that the Clinacanthus nutans extract actually promoted cell migration and cell proliferation of the human gingival fibroblast cells. You can see as a graph below. Here is the graph of the study group is of a different preparation of Phayayor. Compared to the control group at the cell proliferation, you can see that the graph of study group is higher. And also there are other studies about Phayayor. We studied of Serentip and her team in 2014. We studied about the evaluation of the proliferative effect of Clinacanthus nutans glycerin compared to the Moringa oleifera seed oil extraction on the human gingival fibroblast cell line, which I found that the Clinacanthus nutans had no toxicity due to you can see that the percent cells viability of the different preparation here. The study group Phayayor is higher than the control group. And also this study had found that the Clinacanthus nutans promoted cell proliferation. So from the previous review that I have said, you can see that there is no clinical research study about the effects of Phayayor on tooth extraction wound healing, which brings us to the research question. Does Phayayor oral paste affect on gingival healing of simple tooth extraction wounds? Our objective is to evaluate the effect of Phayayor on gingival healing of simple tooth extraction wounds. So now let's continue on part 2, the materials and method. This is our flow chart. The ethic was approved by the Ethics Review Board of Rangsit University on the 21st September of 2021. 22 subjects were evaluated in this study, which is separated into the study group and the control group using the two-block randomization. The first step, we will contact to the dental student and ask for their general information of the patients who will require a simple extraction, age of 18 to 60 years old, no underlying disease that will affect the wound healing, and of course, no allergy or Phayayor and the local anesthesia. And then we will exclude the patient with the complication or the patient that had drugs that will affect the wound healings. When we get the qualified participant, they will be informed about the research condition and we granted the consent. After the simple extraction, the surgery was performed with the 2 stitches for the reference line. If during the simple extraction, there were complications that affecting the wound healing, these participants will be excluded. So here is a diagram, show the we will measure. You can see that here is the line of the steel suture. It would act as a reference line. And then we will stop bleeding. We will stop bleeding for 15 minutes, and then the wound measurement with the 2-digit digital caliper will be performed. After the wound measurement, the control group and the study group we've got the same post-operative instruction, but the only difference is that the study group were given the Phayayor oral paste to use back at home with the instruction, which the instruction is that you need to apply them for 4 times a day on the clean and dry wound after meals, and they have to abstain from drinking and eating for 30 minutes after the gel application. The participant was scheduled to come back for the measure again for the 2nd time on day 3 and for the 3rd time on day 5, and also included having the suture stitch off. If the participant have dry socket or taking drugs that are evading wound healing, have dislodgement of the suture, or have delayed appointment, they will be excluded. Now is part 3, results, discussion, and conclusion. Once all data has been collected, the data of the healing of throat extraction wounds between the control group and the study group normally distributed by the chaperone weightage. To evaluate which phase of wound healing that Phayayor has affected on, we calculate the percentage change of wound distance. And here's the results that we get. You can see that the result will show the percentage change of wound distance compared between the study group and the control group. And you can see that on both day 3 and day 5, the percentage change of the study group is higher significantly than comparing to those control group, which we can conclude that the gingival healing in the study group is more than in the control group. And in this table is a comparison of the distance of wound healing in the day 0 to 3 and day 3 to 5 on both control group and study group, which you can see that it's not statistically different. So according to the results, we found that the percentage change of the wound distance between the control group and the study group was different, right? Which may cause from the effect of Phayayor that will help in the gingival wound healing. From the paper of Sijan 2015 have found that the clinical cancerous Newton's extract had increased the proliferation of the gingival fibroblast cells in the first 5 days, which may occur from the flavonoids that have action in anti-inflammation. So then we want to know which phase of the wound healing that Phayayor has actually effect on. And our study found that the distance of wound healing between day 0 to 3 and day 3 to 5 is not statistically different. That it may be conclude that the Phayayor didn't affect on wound healing only in the inflammatory phase, but it also affects in the initial phase of wound healing by the action of proliferation. In addition, Actually, there are many preparation of herbs that use intraorally. For example, like aloe vera or honey. But since those herbs had an unpleasant side effect, for example, aloe vera may cause redness, burning, and stinky sensation, or honey may cause the dental cavities, while Phayayor has not been reported about unpleasant side effect. So it may be one of the good choice to use to be used in the intraorally. That brings us to the conclusion. The quinine Kansas Newton extract accelerated the wound healing, but since this study is a pilot study, more participants should be added in order to make the result more confident that it can be further developed and applied in dentistry. This research is supported by the College of Dental Medicine and the Research Institute, Rangsit University, Thailand, and we sincerely appreciate the support from Herb and Hope Collaborated for sponsor Phayayor oral piece. Thank you, all advisors, all staffs, and every participant in our study. And that brings me to the end of the presentation. Thank you for your attention.
Thank you for your nice presentation. Okay, is there any question from the audience, from the attendee? Well, during we wait for any question, I would like to ask you, what is the main advantage of using Phayayor oral paste? I mean, the preparation is, there is a lot of preparation from Phayayor, right? Why you choose the oral paste?
We choose oral paste because due to the form of it, we believe that when we add it to the socket, it will stay longer. I mean that. Okay. Let me wait a minute. Okay. We use oral paste because of the form of it, that it was kind of like sticky, that when we use to paste it on the extraction wound, it will stay longer, you know, and it can affect longer. Yeah, we believe like that.
Okay, you like to have the local adherence of the medication on the wound, is that correct?
Yes.
Okay, and what kind of wound do you think that it, I think maybe if you can choose, or if you can have, what kind of wound is suitable for the research project, if not the extraction wound? Any idea?
Actually, I think that we do this project because we want to okay. Actually, in our research study here, we're doing in healthy patient participant, right? But in the future, we think that we have developed the research, we can maybe use in the group of patients who have the disease that will affect wound healing, or the group of immunocompromised patients. For example, like the diabetes that will have the slow wound healing, that we maybe use Phayayor to develop that. It may be help. It may be help in the wound healing of these group of participants.
Okay, you go ahead for another question. I mean, the further question that I'm going to ask you. The effect on Phayayor that you expect for the wound healing is the proliferation, right?
Yes.
Then the wound that may suitable for the Phayayor action, probably whatever that can allow the epithelialization of the wound. And actually, another question that I'm going to ask, you already answered that. What should you apply in the future for your work? whatever that have the proliferation of the wound, but the pitfall, the pitfall or the disadvantage of the extraction wound, it may have a little bit disadvantage of beneath the wound. We don't have anything. We just have blood clot, right? To support the epithelium migration. So it will be better if we have the wound bed with the normal tissue. Are you agree with that?
Yeah. Really?
Okay. What the Phayayor is famous for treatment? Which disease? You can see in your clinical dental practice.
Abscess and herpes.
Yeah.
Treatment.
Who
Yeah.
needs less question?
Any other have question, please? Don't be hesitate to ask your friend.
I have a question.
Oh.
I have a question about why do you using the digital calipers and if there has any other equipment like an intraoral scanner?
Well, we used the digital caliper because it was easy to manipulate, simple to use, and it was quite have a low price. We want to, do it quickly because due to the COVID-19 era, we want to decrease the contamination from the participant intraoral. And if you ask for the intraoral scanner, well, it was one of the best choice because it had accurate. But I think due to the price and the contamination that we want to reduce it. So I think in the future, if we want to develop our research study, maybe intraoral scanner is one of the choices that we will make. Yes.
Okay, thank you.
Thank you.
Is there any other question? Okay. If not, then thank you for your presentation and sharing your research with us today.